Hi everyone, I am glad to meet you again. We today talk about sleep disorders, somnambulism, sleepwalking. What is sleepwalking and why does it appear? Somnambulism or sleepwalking is a special condition in which a person unconsciously performs complex movements during sleep in full accordance with the scenarios of the dream that he sees at that moment. The diseases belong to a group of sleep disorders, which are called parasomnia in the medical literature. Previously, it was believed that sleepwalking is a mental disorder, or that a person who walks in his sleep is possessed by demon. It was also that sleepwalking depends on a certain phase of the moon. It's quite interesting, isn't it? It's not really related to mental illness. Let's figure out what sleepwalking is and why it appears.
Sleepwalking, somnambulism, this is a disorder in which the brain awakes the body, but sleep doesn't stop. A person can get out of bed, walk around the house, do routine chores, wash dishes, put things away, change clothes. But it can also be more complex actions. Some even get behind the wheel in this condition. Sleep consists of cycles that last 90 minutes and successfully replace each other at least 4-5 times per night. Each cycle includes phases of slow and fast sleep. Bouts of somnambulism occur during slow sleep when the sleep pressure is strongest. In this case, the consistency of individual sections of the cerebral cortex should be disrupted. The motor zone is activated, but at the same time, delta waves remain in the frontal parietal zones. Think of slow sleep. This phenomenon is called local sleep or local awakening. Thus, somnambulism is a disorder of sleep regulation in which the motor system wakes up, but consciousness doesn't. During an episode of sleepwalking, a person's eyes are open, but he himself continues to sleep. In familiar terrain, he will move quietly without hurting door jambs and furniture. If you ask him a question, something Wager may answer. It's unreasonable to wake up a sleeper. He may get scared and even show aggressions. If you notice similar behavior in a family member, it is best to gently take him back to bed. According to the International Classification of Sleep Disorders, somnambulism refers to parasomnia, sleep disorders during falling asleep, slow and fast sleep, as well as waking up. There are three groups of parasomnia: disorders of waking up from slow sleep, parasomnia in rapid sleep, other parasomnia. Somnambulism refers to disorders of waking up from slow sleep. There are two types of somnambulism: typical, manifested by sleepwalking and talking in a dream. Movements are well coordinated. Only with this type of disorder does mumbling occur. Often occurring speaking in a dream refers to another type of sleep disorder. Abortive. A person only changes the place of sleep, can just sit on the bed. As a rule, the disorder manifests itself in the first hours after falling asleep during deep sleep. Most episodes last about 10 minutes. Then the person returns to bed and in the morning remembers nothing. Causes of sleepwalking. Somnambulism most often occurs in children. According to research, the peak occurs at 10-13 years old. About 1 in 5 children suffers from this disorder. In most cases, it goes away on its own by the time puberty is reached. Sleepwalking is less common in adults. A person is more likely to develop somnambulism if their parents suffered from it. Signs the disorder is inherited. There are other factors that provoke the disease. Stress. Sleepwalking can occur due to strong feelings about work, personal life, or physical pain. Sometimes nervous tensions in caused by traveling due to being in an unfamiliar environment. Lack of sleep. For example, you didn't get enough sleep all week, and on weekends the body decided to compensate for this and spend more time in the deep sleep phase. This increases the risks of somnambulism. Sedatives. They increase the time spent in the deep sleep phase, which can also provoke a disorder. Alcohol. The risks are especially increased if you drink it before going to bed. Fever. As a rule, this causes sleepwalking in children because of unpleasant sensations. They wake up more often at night, and sometimes the brain can only awaken the body. Obstructive sleep apnea. That is a sleep disorder in which the airways are blocked. A person cannot breathe for a while. This can happen dozens of times a night, which increases the frequency of awakings and accordingly the risk of sleepwalking because the brain may not have time to wake up with the body. Restless legs syndrome, a disease of the nervous system when an irresistibly desire to move the lower limbs constantly appears. It also disrupts sleep and promotes sleepwalking. The desire to go to the toilet or loud noise can also cause frustration. Because of these factors, a person abruptly leaves the deep sleep phase but doesn't fully wake up. Somnambulism itself isn't dangerous. It's not associated with mental disorders, doesn't require treatment, and often resolves on its own. However, sometimes during sleepwalking, a person can harm himself or others, in which case it is worth thinking about safety measures. Hide away sharp and other dangerous objects. If there is a gas stove, turn off the gas overnight. To remove objects from the floor that a person may stumble over. Close the doors and windows at night. Some install lamps with motion sensors to wake up from the light during sleepwalking. Medical treatment of somnambulism. Medications are used only for required seizures that are dangerous for the patient or others. In these cases, the doctor may prescribe sleeping pills, benzodiazepines, and antidepressants. Benzodiazepines inhibit partial awakening in the slow sleep phase and allow you to enter the fast sleep phase. Psychotherapy for somnambulism. Psychotherapy is the main non-drug method of correcting somnambulism. Behavioral and cognitive therapy are most often used. Cognitive therapy methods allow you to form the right attitude to the disorder, correct fears and irrational thoughts. Physical therapy for somnambulism. Physiotherapy has a positive effect on sleep and wakefulness, which reduces the frequency of somnambulistic attacks. In the treatment of sleep disorders, they are used. Phototherapy exposes you to special lamps. This method is based on the effect of light on the pineal gland, which produces the sleep hormone melatonin in the dark. Under the influence of bright lights, the secretion of this hormone stops, the level of wakefulness increases and the emotional state improves, which has a beneficial effect on night sleep. Water treatments. Before going to bed, take bath with additives that have a calming effect, such as pine needles extract and sea salt. The effect of water treatments is based on a change in body temperature and increase followed by a decrease normalized sleep and wakefulness cycles. Physical therapy with sound. Playback of audio recording with white noise. White noise is the natural rustling, the sound of rain, sea, surf, wind, the crackle of burning logs. It drowns out external sounds, which reduce the likelihood of accidental awakening. To prevent somnambulism, sleep hygiene should be observed. Sleep on a wide, firm and comfortable bed. Wear comfortable night clothes. Use dark colored bed linen. Maintain normal temperature and humidity in the bedroom. To make it easier to fall asleep and normalize the depth of sleep, it is important to observe the light regime. You need to spend more time in bright light during the day and use blackout curtains or sleep masks at night. Bright light during the day and avoiding it at night stimulates and production of melatonin, which regulates the rhythms of sleep and wakefulness. To create a physiologically comfortable environment, family, group, individual psychotherapy or psychotherapy at the moments of seizures, as well as learn how to adequately treat the disorder. This will relieve anxiety and help not to exaggerate the severity of the situation. It is important to remember that somnambulism isn't a disease but a disorder. Single seizures, especially when the sleeper just sits on the bed or moves to another place, occur at least once in all people's lives. If somnambulism is associated with apnea or restless legs syndrome, it is recommended to consult a doctor because these conditions require treatment. In other cases, a specialist's consultation is necessary if a patient wishes, if the disorder spoils the quality of life or causes concern for the well-being of oneself and loved ones.